She hears voices.
She's schizophrenic. Explains the DVT. The alcohol makes her pass out. She's immobile for long periods of time.
That doesn't happen. She's not an alcoholic.
She only drinks when you give it to her. We put her on blood thinners. You can probably take her home tomorrow.
It's not the alcohol. It's got to be something else.
Of course it's the alcohol. Hello. This guy's a professional doctor. Plays golf and everything, I bet. He's not going to tell you your mom's an alcoholic without proof. I'm sure he scoped the varices, checked her esophagus, ran all kinds of blood tests. Doctors like this, they don't make assumptions. They do the work.
I'd be happy to refer you the case, Dr. House. You seem so interested.
What case? It's over. Sending her home. How old is she?
You're a doctor?
On my own stethoscope. Did I ask you how old she was? I forget. A 38-year-old woman with no previous symptoms or history presents with deep vein thrombosis. How did she get it?
Oral contraceptives, smoking, diabetes, obesity, and what's the point here? A DVT is a DVT. Put on IV heparin to prevent future clots, and what's the big mystery?
Fine. You're all sleepy. You need a clue. She's 38 years old. She's 20 years too young to get a deep vein thrombosis.
I treated a 12-year-old girl once, a soccer player. She got kicked in the leg.
There was no trauma, none of the risk factors.
You took a history.
I have some notes. They're not mine, but reliable, I think, for the purposes of this discussion. As for the immobility, well, she's real active right now, of course. Paranoia keeps her limber.
Paranoia?
Oh, yeah, she's schizophrenic. And her kid wrote this, so it might be a little biased. You know, having to take care of his nutso mom and all. You think there's a connection? Do we include schizophrenia in the differential for DVT?
Well,
the answer is no. Abnormal dopaminergic pathways in the brain do not cause blood clots. Schizophrenia is not the cause of DVT. On the other hand, we don't really know anything about schizophrenia, so maybe it is connected.
Well, schizophrenia explains one mystery, why you're so fascinated by a woman with a bump in her leg. It's like Picasso deciding to whitewash a fence.
Thanks. I'm more of a Leroy Neiman man. And it is only about the DVT. She's 38 years old.
Right, solve this one and you're on your way to Stockholm.
We don't even know how to treat it. Come on, fumigation of the vagina?
A little louder, I don't think everyone heard you.
2,000 years ago, that's how Galen treated schizophrenics. The Marcus Welby of ancient Greece.
Well, clearly you're not interested.
Oh, I'm interested. I'm interested in how voices in the head could be caused by malposition of the uterus.
Is a better place for it?
And now what do we got? We got lobotomies, rubber rooms, electric shocks. My, that Galen was so primitive.
Where are you going?
I'm going to see the patient. That all-important human connection. Thought I'd give it a whirl.
You won't talk to patients because they lie, but give you a patient with no concept of reality.
If it wasn't for Socrates, that raving, untreated schizophrenic, we wouldn't have the Socratic Method, the best way of teaching everything, apart from juggling chainsaws. Without Isaac Newton, we'd be floating on the ceiling.
Dodging chainsaws, no doubt.
And that guitar player in that English band, he was great. You think I'm interested because of the schizophrenia?
Yeah, I'm pretty sure.
Galen was pretty sure about the fumigation thing. Pink Floyd.
This is Dr.
Gregory House. Nice to meet you. It'd be all right if we spoke alone for a while.
Oh. Well, you're gonna need me to...
Got your case notes, doctor. There's a cafeteria downstairs. Get yourself whatever you want, as long as there's enough left over for a Reuben sandwich, dry, no fries, hold the pickles. Should run you about $5.80 with tax. I'll page you when we're done.
No. Pickles.
Nice kid. How much do you really drink?
He's really talking to a patient?
I don't know who I am anymore.